Hi, and welcome to our Facebook Live special for Holiday Health this month. I am Deanna Squires, Community Outreach Coordinator with Enloe Medical Center, and I'm joined today by Debbie Strukan, the Nurse Manager with Enloe's Behavioral Health Program.
Hello.
And Patty Principi, one of the occupational therapists with our program. So thank you for being here, both of you, and welcome.
Thank you.
For those of you who are tuning in live with us, we want to say thank you for that. And we want to encourage you, as always, to post any comments or questions you have in the comments field. We're going to be watching for those throughout today's program, and we'll do our best to answer as many as we can throughout the next half hour, 45 minutes. But also we want to remind you that the information we're about to share, it's not intended to be medical advice. It's some information we hope that you can use to help make things a little bit better and easier this holiday season. But we do want to encourage you, if you are feeling any signs of depression, anxiety, some of the things we'll be talking about, talk to your healthcare provider, or you can give our program a call. We are here 24 hours a day, and that phone number is 530-332-5250. And we will post that in the comments too in case you need to refer back to that, but we want to make sure you know that we're here for you if you need it. So with that, how about we get started? So Patty, we'll start with you. Right now in the holidays, everybody's pretty busy. There's a lot of things going on, a lot of added pressures that we might not normally have other times of year. But can you tell us about how some of that contributes to stress, and how can someone recognize if the feelings are normal stress or if they're more along the lines of depression or something that should be addressed by a professional?
Sure. This time of year, people might be missing a loved one who's no longer with them. It evokes a lot of emotional response, and people can become more depressed than they would be at other times of the year. And normal stress and clinical depression differ. Normal stress, you might feel frazzled, you might become forgetful, have a short fuse with your family and the people that you work with. You might get headaches. And another thing that people commonly do is clench their jaws. And this is one way to cope, to keep from blurting out what you might be really thinking. I've got a trick for helping a person release that pressure in their jaw.
Yes.
And I can teach it to you. The bad side effects of clenching your jaw are many, including getting headaches and having loss of blood flow into the jaw bones and into the teeth. So your teeth are living things. They need their blood supply. So just like if you're pressing on the tip of your nail and you're blanching out that nail bed, clenching your jaw can have the same effect. So you're reducing the blood supply. So if you want to relieve that, you put your finger in front of your earlobe and release the masseter muscle, which is right here in your jaw. Let your jaw hang open, and whatever you're touching with your fingers is what you are thinking about. So you want to have your brain thinking about releasing that pressure. And major depression, some of the signs are inability to sleep or sleeping all the time, not eating, inability to focus and concentrate. Maybe you can't even concentrate on a TV show or read a book. So those are some of the main differences.
Right. So if somebody, say you notice some of those signs of depression in a loved one, that they're withdrawing, they're sleeping all the time, especially when there's a lot of activity going on, how can somebody reach out to that person and maybe draw them out or encourage them to get some help?
Yeah, there's a lot of symptoms that you can see in your loved ones if they're depressed. If they are withdrawing, if they're just laying around the house, they're not taking care of themselves anymore, they're not taking their showers, not brushing their teeth, like Patty said, not eating, or they're just sleeping too much, or they can't sleep at all. These are all things that could be depression, the best thing to do is to support that person, just to talk to them about it. And of course, Enloe Behavioral Health is here for you to call if you're concerned, or they can call if concerned. Major depression can be as severe as the person having suicidal thoughts. If that's the case, it's okay to ask them if they're having suicidal thoughts. And again, be supportive, offer them some resources, and Enloe Behavioral Health can give you those resources and help you with that. If they're not wanting to take those resources and you're very concerned about them, and you do think they may be suicidal, it's okay to take them to an emergency department or to call 911 and ask them to do a welfare check on the person.
Yeah, that's great to know that you don't want to hesitate. There's resources out there, and we want to make sure that we look out for our loved ones and reach out on their behalf if needed.
Right.
Yeah, thank you. So Patty, you showed us one quick little tip. I love that. I love that you're a resource of all these little things we can use, practical things. So, we talked a little bit about stress, and then more severe the depression. Stress is kind of unavoidable, it seems like. So do you have other ways that, if we're in the moment, besides our nice little massage, what's some other tips that people can use at home to alleviate some of that momentary stress?
Well, in my opinion, the most important thing is breathing and allowing your diaphragm to do its job. So we need to relax our bellies, and the best way to do that is, again, whatever your fingertips are touching, that's what you're going to be concentrating on. So if you lightly rest your fingertips on your belly button and breathe in deeply into your belly, and breathe out, suck in your belly button. This will trigger your parasympathetic nervous system to go into rest and digest mode. You want your diaphragm to descend when you breathe in so that your lungs can fill up. And you want to suck in your belly so your diaphragm will ascend and push the air out. So instead of going into sympathetic mode, which we also call fight or flight, we want to go into rest and digest mode. So breathe all the time.
It sounds so simple, right? But even I was following along with you when you were describing that, and I just felt this calm suddenly come over. The nerves go away.
Yes.
It's very restful, just that one really simple act. So good reminder. Remind ourselves to breathe. Some other things, there's a lot of little tips. So breathing, the massage. One of the really cool things I know we do here at Enloe, both at the hospital and behavioral health, is aromatherapy. So Debbie, can you tell us a little bit about what is aromatherapy, how do we use it, and how can people use it at home?
Yeah, we do use aromatherapy, and we find it to be very helpful with our patients, and it can be helpful for you at home too. We use 100% essential oils, and that's because they're pure. There's no additives or scents put into them. You can get them at any grocery store or health food stores, but you do want to make sure they're 100% essential oils. What we use here at Behavioral Health is lavender. Lavender we use for depression, anxiety, and agitation. We also use ginger, and ginger is used for digestion, so for nausea, vomiting, diarrhea, that kind of thing. And then we use bergamot. Bergamot is used for depression, nervousness, insomnia, and agitation. And peppermint. And peppermint's good for headaches, nausea, depression, and anxiety. The way we use it here is we put a few drops on a cotton ball, and you just put it up to your nose and inhale it. Take deep breaths and inhale it for 3 to 4 minutes, and it really has good effects.
Yeah, it kind of combines both of those tips, the stopping and breathing and relaxation, and then the aromatherapy to go along with that.
Right.
That's neat how that the different scents can trigger different reactions and help people with what exactly you're experiencing at that time.
Yep.
Very cool.
Yeah.
And I think you mentioned, but just to kind of reinforce, we want to make sure that if you're doing aromatherapy, you said the essential oil is 100%. So it's not like, I don't want to just light my candle and see what happens, but it's very intentional. And health food stores and grocery stores, places like that, are places people can get them readily.
Right. And we do have a brochure on our website for more information. So you could go to the Enloe website and see the brochure.
Nice. And we'll post the link in the comments too, so people will be able to get it. And I guess while we're talking about the website, we can tell you right now. So if you do want more information, there's a wealth of information on there at www.enloe.org/wellness. So feel free to visit there and see what other information and resources we have.
Right.
So oftentimes anxiety and stress go hand in hand. So especially with all these added expectations, for people who are experiencing anxiety during the holidays, Patty, are there other relaxation techniques maybe you can share with us that people can use at home?
Sure. A lot of times we are all in our heads. There's a lot of chatter, there's a lot of lists, and so many things we have to do. So I like to help my patients kind of get in touch with their bodies and realize how they're feeling. A lot of times their shoulders will ratchet up as they become more and more anxious.
It's that tension that you're talking about with the jaws. It's like that upper body.
Yes. And so try to concentrate on lowering your shoulders, and I'll teach you a great neck stretch.
Thank you.
So we're going to put our fingers in extension, drop your arm down at your side, and the opposite ear from your fingers is involved. Stretch your ear towards your opposite shoulder, and you should feel a really good stretch here. Don't overdo it. Nice and easy. And then extend the fingers of your other hand and drop towards your opposite shoulder with your ear. Again, don't overdo it. More is not always better. So kind of know your own body, what you can tolerate at the moment.
Just a gentle stretch. And remember to breathe. We can go back to that breathing at the same time.
And then there's the side stretch, which is very easy, and it gets all the way down to your hip. So if you reach your palm up to the ceiling, support yourself on your chair so you don't end up on the floor.
We want to do that.
And just gently stretch to the opposite side. So there's a difference between reaching with your fingertips and reaching with your palm.
Oh yeah. It's true.
So we're not going to just do one side, we're going to do both. So reach up with your opposite palm, support yourself on the chair, and gently stretch over.
If you're at home, you can be stretching with us too. Get a nice little relaxation break.
And then remember to breathe. And now, do you feel a difference in your torso?
I feel relaxed.
You've stretched it out? Right.
What I love about all these tips that you're sharing, and they're very practical. So
They're
whether you're sitting at your desk, whether you're in the kitchen cooking and your family's chattering in the hallway or whatever, it's so easy to just take almost like a little time out. I think, we can put ourselves in a little time out and do these little tips, and I think that helps.
You can do them when
just
you're sitting or standing.
Yeah.
Yes. And they say that you get the maximum benefit of a stretch if you hold it for 30 seconds, but you can get a good benefit even with 10 seconds.
Right.
It doesn't have to be the full 30.
Right, but just a gentle stretch, it sounds like, is the key there.
And it works.
Yeah.
It looks very simple, and it seems simple. It seems, how can that help anything at all? But it really does work if you do it.
Yeah, that's the best part of it. We like to give you guys simple things that really do make a difference. So besides stretches, we talked about stretches, aromatherapy, breathing, other things in our environment I know can play a part in either reducing or increasing stress and anxiety. So do you want to talk a little bit about that, like lights and sounds? And
Sure. I'll talk about lighting first. Some people are very sensitive to fluorescent lights. There's a very subdued flickering that bothers some people, and also there might be issues for some people with cool white lights, so that that spectrum from which that bright light comes can bother some people. So you might want to consider turning off the fluorescent and bring in a lamp or have some kind of incandescent light bulb. This will decrease your cortisol levels and reduce light stress. We want to create a positive endocrine response. We want our hormones to be, working with us and not
working against us.
Yeah, not jacked up. And then another thing that you might want to consider is the eye fatigue and the dry eyes and the blurred vision that can come from looking at all of the screens, your computer, your phone, your tablet. Your eyes can become very tired from that, and you can get headaches. So you might reduce the brightness of your screens, or some people even get yellow tinted glasses to reduce the effects of the blue light.
Oh, interesting.
There is a sporting goods store here in town that sells the yellow tinted glasses for $13.95.
Interesting. Or put the tablet down and interact right there with the people with us. That's another tip. That's hard to do, but it's a good thing to do.
We have 12 cranial nerves, and 6 of them are involved with eye function.
Oh, wow.
Yeah, so even just blinking or closing your eyes, taking a break, looking away from the screen, all of that will help.
Nice. And then sounds like music. There's a lot of music and things in the environment these days. How does that play a role in?
So if music soothes your soul, turn it on. Whether it's Christmas music or rock or country or gospel, opera, but music can be tricky. It can evoke, like I said, some sad memories. And what I like to play for the patients is a synthesized music by Henny Becker. It helps the patients go into, create the alpha state in their brain waves, and they become calm but alert.
Right.
So it's a very special place to be.
Yeah, so maybe you can play with that a little bit. If there's music you like but you feel tense, maybe try changing it up a little bit.
Right, and if it's reminding you of sad memories, flip it to something that you can tolerate.
Yeah.
And then some people really need quiet. They have so much input that they need to just calm themselves.
Right, there's a lot of stimulation.
Mm-hmm.
So somebody commented they wanted to know the name of that musician again that you mentioned.
Henny Becker, HennieBecker.
Awesome. We'll have to check them out. Thank you. All right. So a lot of great tips so far. I want to go back though to earlier we were talking about depression and some of the more acute symptoms people might have and resources available for them. So Debbie, you're the nurse manager at Enloe's Behavioral Health Program. Can you tell us a little bit about the program, the resources we have for people who do need that extra care?
So at Enloe Behavioral Health, we're an inpatient psychiatric unit. So we're a nursing program of Enloe, nursing unit of Enloe Medical Center, but we're not at the main hospital. We're over on 560 Cohasset Road, so we're off-site. And we are inpatient, like I said, a voluntary psychiatric program. So people that are in a psychiatric crisis that needs inpatient hospital stay would come here. We are for adults 18 and over. We're voluntary, like I said, which makes this a very unique program. And we take Medicare and private insurance. So it's a hospital stay, just like you would check yourself into any hospital. It's 24 hours a day. We have around-the-clock nursing care. We have 2 psychiatrists, wonderful psychiatrists that are here. And we have some extra help from a nurse practitioner and a community psychiatrist to help us on the weekends and for night call, that kind of thing. We're a group-based program, so we have nursing groups, social work groups, and occupational therapy groups all day. So when you come in, you'll be in groups most of the day.
Very good. Now, is a referral needed for accessing the behavioral health program?
So no referral is needed. The way you come in is either you can call us and make an appointment, or you can just walk in. Like I said, we're 24-hour-a-day nursing, so an RN is here 24 hours a day to talk with you if you need to either call or just walk in. When you come in, an RN will assess you, do a psychiatric assessment. It can take about 2 hours, but it's a real thorough assessment so that they can then give that information to the psychiatrist to see if criteria is met to come in. Our criteria is suicidal, homicidal, and gravely disabled. And what gravely disabled can mean is, if you've become so anxious that you're no longer coming out of your house, or you're starting to not be able to go to work or not be able to go to school, or you're so depressed that you're not coming out of your house, you're just starting to become suicidal. If you are manic, or if you have psychotic symptoms, all those things can fall under gravely disabled.
And sometimes it's not necessarily easy to know if you're at that point,
Right.
especially when you're in that moment.
Right.
And that's what I love about the fact that we're 24 hours a day. There's always somebody here you can turn to. And if you're not sure, I would think call,
Yes.
right? So
Yes.
call that 530-332-5250. Whether you're the person or the loved one, I think anybody can call and just talk to the nurse and get kind of some guidelines. And then if they come in and they're not sure, that's what we're here for, is to...
Right. So whether you're admitted or not, the RN will give you resources.
Right.
So if it's decided that you're not quite at the level of needing hospitalization, they'll give you the community resources and outpatient resources.
Yeah, it's important to know there is help available.
Yes. Yes.
So you mentioned the assessment, and you also talked about groups. So do you want to tell us a little bit more about that? Because I know some people that I know, they get a little nervous in groups. So how do we help them?
Well, you come in for your assessment, and if you're admitted, you come right onto the unit. And to know more exactly what our program is and what to expect during your stay, if you go to our website, www.enloe.org/wellness, it gives you detailed information about what to bring and what to expect. But our groups we have nursing groups, social work groups, and occupational therapy groups. The social work groups are skills group and process groups, and then occupational therapy groups are movement groups and art group. And you get a lot of tools and coping skills from those groups, and you're really able to process things. We're very individualized. So if you are someone who is really not comfortable in a group setting, we figure that out for you. We talk with you. We do what's right for you the time that you're here. So you would not have to feel like if you came in, you have to go to groups and you might have panic attacks. You don't have to worry about that because we'll individualize our program to what you need.
Yeah, that's wonderful. And we talked a little bit about Patty being the occupational therapist. You're probably really involved in those occupational therapy groups and implement some of those stretching and breathing and things that you've been sharing with all of us today.
Yes.
Yeah.
2 hours in the afternoon, I'm with the patients.
Nice.
Yes. It's very rewarding. The patients get better.
Yeah, that's wonderful. So the assessment, you mentioned that it's 2 hours. That's a long time. Do you want to talk to us a little bit more about that, what the process is? Patients would be meeting with a nurse?
Yeah, so you would either call the unit and talk with the nurse on the phone and decide whether or not you want to come in for an assessment. Or, like I said before, you could just walk in and say you're here for an assessment. And we'll bring you into an office off the unit, and an RN will do the psychiatric assessment. And they're, assessing what's going on with you, what kind of crisis you're in, how we can help you, and if we need to provide other resources for you. So it is a little bit of a long process, but it's very thorough, and the patients get a lot of benefit from it. Once you come in, like I said, you come directly on the unit. You have a room usually to yourself. Our rooms do have 2 beds in it, but generally you have a room to yourself. You see a psychiatrist every day, and round-the-clock nursing staff. We have a very highly qualified nursing staff, occupational therapists, as you see here with Patty, and social workers. We have dietary that comes. We have different groups besides the ones I've already talked about. We have pet therapy come sometimes. We have music therapy that comes sometimes. We have AA is provided on the weekends for only people that want it, and it's only for our patients. And NA is the same for only people that want to go, and for our patients only.
That's awesome. That's such a wealth of resources right here on site. I love the pet therapy and the music therapy. That's our Enloe volunteers, right, that provide that.
Yes.
Yeah, they're a pretty special group. We love them. So we've talked about some great tips: the stretching, the massage, the breathing. We talked about depression and the resources available. Is there anything else that you guys would like to share with our audience while that we're here today? Things that would help them manage stress and anxiety during this busy time?
Sure. My best advice is manage your expectations. Don't expect too much of yourself or your loved ones.
I think that's the hardest tip that we all need to hear.
And perfect is not necessary. So one of my favorite mottos is good enough is good enough. Instead of being disappointed with maybe a partner or a family member who doesn't want to, say, string up the Christmas lights outside, and that person has never wanted to do it, why expect them to do it? Find someone else to help you do it, or hire someone, and then appreciate that person who doesn't want to string the lights for what they do like to do. Right. Maybe they like to cut down the tree, or make the meal, or write the card, something like that. Also, you can send happy messages to your brain just by smiling. So when we're feeling an emotion, it usually shows on our face. Our muscles will reflect the emotion that we're feeling. And you can trick the brain by doing a backwards thing and smile. You don't have to do a big toothy grin, but a real genuine smile, and that will send a message to your brain that maybe I'm getting a little endorphin rush, maybe I'm happy. Really, we take ourselves so seriously, and let's just enjoy the moment. Try to be in the moment, and if you're wrapping packages, just enjoy the heck out of it. If you're making cookies, or if you're visiting or out with friends, don't worry about what you have to do in an hour or the next day. Enjoy that moment. Yeah, enjoy that very moment.
Yeah, it's kind of the mindfulness. I know we've talked about that in some of our earlier sessions too. It's just grounding ourselves and being present really can go a long way. You mentioned smiling. I love that, because I know even just when you're walking down the street or something and you're in a hurry, if somebody smiles at you, you suddenly go, oh gosh, I kind of feel good. So.
And you know what out-of-towners say about Chico residents?
No.
They smile so much.
It's because we're so happy.
I've never been in a town where people smile so much.
I love that about our town.
Yeah.
And Debbie, what about you? What things do you want to make sure we leave with today?
Yeah, I want to make sure everybody really considers their quality and quantity of sleep.
Oh, that's a good one.
Yeah, we kind of get wrapped up in things and forget about that. We all know how bad we feel the next day when we don't get good sleep. But if you get very poor sleep or no sleep for a few days, it can trigger things like anxiety and depression, and even psychotic symptoms like hallucinations. So it's really important to think about your sleep. one thing to consider, when you go to bed, it should be for sleeping and not watching TV or reading your electronic devices. Yeah. You can train your body to go to sleep if you go to bed and just lay there and go to sleep. Remember, the blue light affects your sleep by messing with your circadian rhythm, so keep that in mind. So you really shouldn't be using your devices for a little bit before you go to bed. The other thing to consider is alcohol use. Sometimes we think that having a glass of something will put us to sleep and help us sleep, but actually it disrupts our sleep. And it disrupts the second half of sleep by frequent awakenings, and it reduces the REM sleep, or the deep sleep that we get. So even though you think it might be helping you sleep, it really isn't. It's really disrupting your sleep.
Yeah, it helps initially, and then, but you're not getting that deep,
you're not getting
good
that
restorative
deep REM sleep. Yep.
Yeah, that's so important. And people want to shoot, I think I've heard, for about 8 hours of sleep is a good amount of sleep.
Yep.
So that kind of goes back to managing expectations and not overextending, so we can get back good sleep and feel rested. So anything else? Should we practice our techniques one more time in case people want to be reminded of our massage? This is the masseter muscle massage.
Find your masseter muscle, the muscle of mastication, also known as
for
chewing. So your masseter muscle is here. Let your jaw hang open and massage the muscle.
Feels good.
So some people have such tight masseter muscles that it takes them years to learn to relax them.
Well, a lot of people do clench their teeth. And
yes,
so,
they do.
I mean, that's sometimes you don't even realize it, but releasing that tension, I could see how that would really help.
If you do it several times a day, your brain will be more alert, able to alert you that you're clenching, because again, whatever you're touching, you're concentrating on.
You're reminding yourself.
So if you do this, say, once an hour, after a few days, your brain will say, eventually, you're clenching. You better stop.
So before we do the stretch again, we did have another question posted. So you mentioned we have 2 psychiatrists here on staff, and they're wonderful. I love our doctors on site here. Do you want to tell our audience who they are, maybe a little about them?
Yeah. So we have 2 psychiatrists that they've both been here for about 5 years. Really engaged, wonderful doctors. Dr. Nichols is our medical director, and Dr. Amir is our other psychiatrist. Dr. Amir specializes in addiction, and Dr. Nichols on the side specializes in oncology psychiatry.
Right, and they're both very kind, gentle,
very wonderful doctors.
Yeah, I've appreciated that when I've had the opportunity to work with them in the past. If you want to learn a little bit more about either of the physicians, we do have some information posted on the website. You can go to enloe.org/doctors and either search by their last name, Dr. Amir or Dr. Nichols, or search by the specialty, and you can learn about kind of their background a little bit more if you'd like. All right, well, one more stretch, and then
Shall we end with some stretches?
I think so.
Let's do it.
Okay,
All right.
Our
Make sure
down, right?
Make sure you're stable in your chair.
Okay.
And reach with your left palm
And palm
up to
up.
the ceiling. Support yourself and stretch to the right.
All right, everybody. I hope you're stretching at home and you're relaxing and enjoying everything that this season has to offer. Thank you so much, Debbie and Patty, for being here today.
Thank you so much.
And thank you all for being there at home and joining us. We hope you've enjoyed it, learned some things that'll help you out. We'll look forward to seeing you in the new year. And in the meantime, happy holidays and have a great afternoon. Bye-bye.
Happy holidays, everyone.
Bye.